Well, good afternoon, everybody. My name is Emily Russell, and I have the pleasure and privilege of doing the marketing and the outreach here at Clearview Regional Medical Center. I see a lot of familiar faces, so I'm glad you guys are back, and I see some new faces, so welcome. We're so glad that you've joined us. We do a monthly lunch and learn event just like this every single month. The date kind of varies because I try to structure it around our physician schedules when I can actually get them here to speak to you about a particular topic. And the topic usually varies as well. So you'll learn something a little different each time. This time we actually had planned to have Dr. Johnson come and talk to us about bone health. Unfortunately, he had a last minute emergency that called him out of state. So we are blessed with Dr. Julie Allen. And Dr. Allen is brand new to our medical staff. She's like 15 days on the job so far here with us. So she came to us from New York, New Jersey, by way of Augusta, Hephzibah. She was practicing down below Augusta for a while. And so we are just so blessed to have her as part of our medical staff now. She is part of our primary care network, our employee primary care physicians, and her office is located over on Breedlove Drive, just across from the old hospital. So how many of you guys already have a primary care physician that you identify with? Okay, most, but not all. You know, the interesting thing is I find that so many adults, we neglect our health and we neglect to have a primary care physician that actually works as that gatekeeper for all of our medical information. So Dr. Allen is a primary care physician. She specializes in family medicine, so pediatrics all the way to geriatrics, and she's currently accepting new patients if that's something that you might be interested in. So without any further ado, I will just turn it over to you, Dr. Allen.
Thank you so much.
Absolutely.
Oh, you're so sweet. She gave me such an awesome introduction. So, I'm happy to be here, and the presentation topic I selected was heart health, pretty much. So basically going into what's heart disease and what can we do to prevent it, and kind of going into exactly how does heart disease start and what do you expect if you might have symptoms of heart disease. So the heart is the organ that's responsible for all the blood flow to the rest of your body. So if the heart is unhealthy, vital organs may not work as well, such as the brain, liver, kidney, muscles, etc. It can be very uncomfortable for someone to be living with heart disease or to start experiencing the symptoms of it. Usually, the patient will present with, symptoms of feeling very tired. A lot of people know of the chest pain, but it's more than that. Feeling tired, dizzy, just not really yourself. So over time, if you have worsening heart disease, it can affect the rest of your organs, and that's when you have that overwhelming sense of just feeling tired and not yourself. And some people even tend to act strange if they're not having enough of that blood pumping effectively to each of your organs or to the rest of your body. Okay, so what is heart disease? Heart disease is the disease of the vessels, the arteries supplying blood to the heart. So the vessels that we're talking about are the arteries. Now when we're talking about this type of vessel disease, the most common form of it is atherosclerosis, okay? So atherosclerosis, have you heard of that, what atherosclerosis is, or it's kind of a new term, or it's just kind of been thrown around? How many people have heard of it? Kind of, sort of, okay. So basically, atherosclerosis is fatty buildup referred to as plaques, which are deposited in the arteries. So over time, it might just start off as something very small, fatty deposits that build up either from having a very unhealthy diet for most of your life, and also having high cholesterol and even smoking. So these can get larger, and it makes it very difficult for blood to flow to those very important areas of the heart. And the heart is a muscle. This is what keeps blood flowing to the rest of your body. So you need enough of that good blood with that good oxygen supply flowing to the heart to make it work more efficiently. So that's a picture of atherosclerosis on my left, your right. So on my right, pretty much a normal artery with its 3 layers, blood just flows freely through it. With atherosclerosis, you see the plaque that's formed, the fatty deposit with calcium as I mentioned, stemming from a long history of smoking, a long history of unhealthy eating. So as you notice, they can vary as far as like how much of the diameter of the artery it takes up. So if it gets larger and larger, you know, resting, when you're just relaxing, sitting, you might feel fine. But once you start making the heart go to work, meaning standing up, going about your daily activities, you might start feeling that stress of that decreased blood flow to your heart. And that's where you have that chest pain or something just doesn't feel right. Okay? So that's a picture of the heart. No need to memorize like the vessels and the structures, but you know there's smaller vessels going to those important areas of the heart. You know, the heart is divided into 4 chambers. The largest, the chamber that's responsible for pumping blood to the to your body, the left ventricle, that's the thickest heart muscle, and that's a very common area where anyone who has this type of heart disease may suffer damage, because this heart muscle gets thick over time with a long history of high blood pressure, and the fact that you might not have enough blood flow or enough oxygen flowing to that area, that can cause those chest pain symptoms or cramping. Essentially, the chest pain is kind of like the cramping that you might feel in your leg if you're not getting enough blood flow. It just hurts a whole lot, and it can present in different ways. Okay, so atherosclerosis ultimately compromises blood flow to the heart. So over time, you'll end up with decreased blood supply to those specific areas, and someone might struggle with chest pain, feeling tired, fatigue, something just feels strange. Some people end up getting some shoulder pain. I know that, you know, when you think of a heart attack, you think of that chest pain, feeling dizzy, or pain radiating to your shoulder. That has to do with the way the nerves are involved. Usually you have this pain kind of radiating to your shoulder or to your jaw. It's referred pain. It has nothing to do with pain, you know, injury to that specific area. That's just kind of the way our body works. But someone may be sitting down, resting comfortably. If they've had a long history of this atherosclerosis or this decreased blood flow, they'll start getting pain, you know, just out of nowhere. You don't even have to work your heart that much, you know? But of course, if you have these chest pains and you say, for example, you're seeing a cardiologist already, they've put you on these medicines to help you, and that medicine is not helping you at that time, you need to seek treatment immediately just to make sure you're not having a heart attack. Now, heart attack essentially is the death of that heart muscle, a portion of your heart. It could be a small area, it can be a large area, depending on how big of a piece of that plaque breaks off and to which vessel it travels to. As you know, the arteries, they branch off into smaller and smaller ones just to supply that area. You never know, that plaque can be large enough which can occlude a large portion of your heart pretty much, and that's where you end up in the hospital, and you know, we try to get as much blood flow to the heart as possible to help it heal. And some people suffer with irreversible damage where their heart is just weak because of that heart attack. Okay, so if you're having symptoms of the disease, discuss it with your doctor or healthcare provider. What they'll do is they'll assess your symptoms, ask you tons of questions, review your history, and they'll determine if it's likely related to heart disease. Usually from that point, they'll recommend a test, typically a stress test. They might do an ultrasound of your heart just to kind of see how your heart is pumping. If they find something abnormal with that, they'll usually refer you to a cardiologist. Sometimes they'll go ahead and refer you to a cardiologist so that they can assess and see if this is truly cardiac in nature. It could be something else. Chest pain can be from anything, acid reflux, you hurt yourself, you fell sometime, but it's better to be safe than sorry. Always see your doctor about these things. Some medicines may be prescribed to help keep vessels open and to help with the heart rate. So there are medicines called beta blockers like metoprolol, carvedilol. That's usually helpful in slowing down your heart rate a little bit so it doesn't have to work that much and so that it can pump efficiently over time. Therefore, ultimately, you won't be having like those chest pains associated with like that decreased blood flow. This is typically for those who struggle with heart disease. But of course, those medicines can also be, you know, for people who have heart rate issues or blood pressure problems, not necessarily blockages. And then some people are put on blood thinners, and aspirin is a pretty good medicine, good to take every day just to prevent like those clots from forming or any blockages or worsening of the blockage in your heart.
I take Bostolic. Is that medicine for the heart?
Yeah, it's medicine for the heart. Ultimately, these medicines that are prescribed, they typically prevent the heart muscle from getting so thick. They also decrease the heart rate over time, just to help the heart pump more efficiently. Also, if you have any, like a history of the atherosclerosis or you've had a heart attack in the past, they found, like research has found, that if you decrease the heart rate, you're not going to have as much of those symptoms that you used to have, and you're not likely going to have another heart attack in the future or worsening of your symptoms. So they're pretty good. Okay, so who should be concerned about this? Everyone, all ages should be concerned, but there are those who should pay close attention. So the ones I'm referring to are people who have those risk factors: diabetes, high blood pressure, cholesterol problems, anyone that's had a history of smoking, which I'm going to get into in a second. So hypertension or high blood pressure, those with high blood pressure, the heart muscle gets thick over time with many years of blood pressure problems. It makes it hard to pump effectively, plus there's more demand for oxygen on the heart muscle itself. So just like a bodybuilder is using those muscles all the time, you know, the force or the weights that they use help the muscle get thicker. The weight for the heart is basically the blood pressure. It has to pump a good amount of blood against so much resistance from that high blood pressure. It'll get thick over time. And what happens? You need more vessels. You need more oxygen, you know, for that area of the heart so it can pump effectively. Another problem with the heart muscle getting so thick, sometimes it becomes stiff over time where it's not letting out enough blood out of the heart. You need the heart to pump in that nice rhythm. If it's stiff, it just it's just all bulk and no dew. So that's just something to think about with high blood pressure. And then of course there's diabetes. Everybody knows it as like the sugar disease, but we physicians, we look at it as a vascular disease. It will affect your vessels over time. Not the large vessels, but the small vessels. That's why we have these eye exams, just to make sure your vessels and your retina look fine. Also, if anyone knows anyone with really bad diabetes, they end up having like really bad wounds on their heels or, you know, legs, ulcers that are very hard to heal. Though it takes small vessels and a good amount of oxygen to help the healing process. So just imagine what it might be doing to the small vessels in your heart. You're not having enough blood flow to those areas, hard to repair any tissue that might be damaged over time. So we typically consider, you know, diabetes to be one of those diseases we need to get under control to make sure that the heart, you know, is healthy. Okay. And then anyone who has a family history of heart issues, anyone who's had a heart attack, anyone who has had heart failure, you know, that's a red flag for us physicians, because then we look into those risk factors, which is diabetes, high blood pressure, and high cholesterol. Cholesterol plays a role because, as I mentioned earlier, this is directly involved with the development of plaques in your heart or in the vessels of the heart. And then being heavy, being obese, that is typically associated with high cholesterol and high blood pressure, because you've got to pump enough blood to the rest of your body, and if you're larger, you need typically a, you know, larger oxygen supply. Okay, so what can we do to help our hearts be healthy? So everyone should do this. Eat healthy, exercise regularly, reduce stress, drink plenty of water. It sounds easier said than done, but I typically tell my patients, I kind of target the problem areas for them and figure out a way that we can incorporate that aspect of the healthy lifestyle in their life. So when I say exercise regularly, I'm not expecting you to run a marathon. I assess what you're doing on a daily basis. A lot of people, typically nothing really. So, you know, I will suggest maybe dancing around in the house for like 4 or 5 minutes. Some people like to dance. There are others that have bad knees. I ask, do you dance a little bit? You know, are you doing a lot like with your arms? I just come up with some exercise, because ultimately the definition of exercise is basically keeping your heart at a certain rate, an elevated rate for a good amount of time. And that over time helps the heart pump more efficiently, so that when someone is just sitting at rest, it doesn't take that much effort, meaning a higher heart rate, to get blood to the rest of your body. So it does make your heart healthy over time.
I lay in bed and do mine in the morning and at night before I go to sleep, but just lift my legs and arms, and
That's fine. That's completely fine.
it's helped me a lot.
Yeah, it gives you more energy. You feel relaxed. You're not tired all the time. Initially, you'll be tired once you start exercising, but maybe after a couple of weeks, you'll start noticing that you have a little bit more energy, and you're working some of those muscles that, needed some working. So,
Does it help you sleep too?
yes, it does.
Yeah.
Exercise does help you sleep. So exercise, as I mentioned, helps make your heart more efficient, so that you could pump more blood to your body, as a result lowering your blood pressure over time. That's why they associate exercise with lower blood pressure. So examples, start with walking maybe 5 to 10 minutes a day, then gradually increase to about 30 minutes. Join a walking exercise group. This will keep you motivated. Some people find certain exercises boring. Just challenge yourself. Start off, as low as possible, maybe 3 minutes. I'll play my favorite song at 10 o'clock, and then I'll try again, with this song at, 6. Just pick a time and make it an appointment for yourself, just like your doctor's appointment. I need to do this time so that I can feel good. So I just included a picture of a family, the healthiest family in America, pretty much. It starts off when you're younger. Once you teach your kids this stuff, hopefully they'll carry on with it and not indulge in those sweets and, staying at home playing their games and all that stuff. Okay, so eating healthy, definition of that: low fat, low salt, lower carbohydrates. Carbohydrates, your bread, sugars. It helps with cholesterol, high blood pressure, and diabetes. So you talk to your doctor about it. So depending on what your health status is, if you have problems with your kidneys or you're on blood thinners or whichever it may be, there's a specific diet that your doctor typically wants to follow. But honestly, this goes for everyone. Yeah.
My kidney doctors prescribed a salt pill to keep my salt up to a certain level.
Mm-hmm.
How am I to know how much salt and how less of the salt? Because it has certain side effects,
Mm-hmm.
but it is doing what it's supposed to, this pill.
Okay.
And,
Yeah, they're a select population.
I mean, is that certainly, if he prescribed it, it doesn't affect the heart. It's too much salt, it doesn't.
No, usually whenever we get to the point where we have to prescribe you, salt, or recommend that you add some salt to your diet.
I'm having checks every so often.
Okay. Your body functions well when everything is at an even level. So if your sodium gets too low, that can be dangerous.
In the past, it happened to me.
Yeah.
I don't want it to happen again.
Right. You keep following his rules on how much sodium to take. Usually, I think dietary recommendations about 2,500 milligrams, 2 grams of salt a day. But if you do have high blood pressure, typically we'll recommend a little bit lower. Now, your problem is opposite. If you do have any problems with your kidneys, there's an issue with emptying out your electrolytes and keeping the good ones in. So electrolytes meaning like your sodium, your potassium, magnesium, chloride, all that stuff. So they're supposed to be within normal levels. If you have too low of a certain amount, your body won't like it. You might act strange. You might feel really tired, out of it. Someone will notice something's a little off about you. And some people suffer from muscle cramps. Typically, that's a very common thing. So
That's no fun.
no, it's not fun. I haven't had that issue, but if people are coming to me about it, then I take it seriously. So, but yeah, just listen to your doctor about that.
How many vegetables, 5 or more a day?
That sounds about right. About 5 or more a day, maybe 4 to 5. It's so difficult to get vegetables in. It's difficult. Yeah, that's fruit and vegetables.
Yeah.
So it's difficult to get vegetables in, but about 4 to 5 is just fine, like serving size. They say it on all the nutrition labels too, so that's something that you might want to pay attention to. Okay. So talk to your doctor. It's okay to ask questions about how medicines work and how it will impact your disease. Don't think that taking medications are giving you the disease. The goal is to stay on top of it. So that is so important. When you come to visit your doctor, it's not that we want to find something wrong with you. It's just that we want you to take control of what might be lingering. That's all. It just means that you're on top of it. You don't let that disease overcome you. You stay on top of the disease. You make sure you're feeling fine and you will be okay. That's all it means. It's an agreement. The physician and the patient talk. We come to a conclusion of what might be important for you, like based on what is most important to you, and then we just take it from there. And then we congratulate you when you're doing well. So. All right, and then important to know your symptoms again: chest pain, shortness of breath, weight gain, breaking into a sweat. You tell your doctor about these things, ask questions so that you can understand the benefit of these medicines. Okay, and that's pretty much it. Are there any questions? I know I answered a couple during the presentation.
I have another one.
Sure.
It has to do with the blood pressure meds that I'm taking.
Mm-hmm.
And I've been taking them a long time, twice a day.
Mm-hmm.
And actually, the only time my blood pressure really gets really high is when I go to see a doctor.
Okay.
Because I'm
White
sorry,
coat
but
syndrome.
There you go. You said
I
it.
have seen so many doctors
Mm-hmm.
because of severe osteoarthritis.
Okay.
And so in the meantime, I had all these tests that reveal that I did have a leaky heart valve,
Mm-hmm.
the aorta. And so to me, that was pretty serious. But the plaque, a small amount of plaque was there, and the doctor did not think anything I should worry about it
Mm-hmm.
until it gets worse,
Right.
And then I don't know if I can worry about it or not, but
Mm-hmm.
at this point, I'm being very careful.
Mm-hmm.
But it went up to my pain doctor. I'm in pain unless I take meds now.
Mm-hmm.
It's 2 crushed vertebrae at
Okay.
the bottom of my spine, and one above is out of place.
Mm.
No surgery in the forecast.
Okay.
So that was a hard pill to swallow
Mm-hmm.
since I've been so active. But being so active has caused my bones to deteriorate, I guess, because I would stop maybe and not eat the right thing. I'm eating the right thing now.
Mm-hmm.
And always, I think I have, haven't you? She monitors me.
Okay.
But still, you don't know. Really, when it goes up, they get so excited. And I said, I have white coat syndrome.
Yes,
doctor."
it's real. It's real. Because think about it. When you were a child,
It really is.
you were taken to the doctor. They gave you shots. That was terrifying, the most horrifying experience for you, and you had no choice. So that's instilled in your head that, oh my gosh, this doctor is going to do harm to me. Even when you are trying to tell yourself consistently, oh no, I've got control of this. They can't make me have a shot if I don't want to have a shot. But people just get this elevated blood pressure anyways. Typically what I do is I just ask the patient to bring their blood pressure cuff in with them just to make sure it's reading okay. And if your blood pressure cuff is accurate, checking it from home is just fine. If your blood pressure is reading fine on your blood pressure cuff, at home, then I'm happy with that. There is such a thing as white coat hypertension. Now, if your blood pressure just stays high, then that's something else that needs to be addressed. So,
Does HDL build plaque like LDL?
HDL, well, LDL, this is the thing. HDL is good cholesterol. It's associated with really good cardiac outcome. People who tend to exercise a good bit, eat the right foods, have an elevated HDL. LDL is the bad cholesterol. That's the one that is highly associated with plaque buildup. So whenever you have your cholesterol check, we check that, we check total cholesterol, but we tend to pay attention to the LDL and the HDL. LDL is like, it's high, that scares us. HDL, when it's high, it's like, oh wow, awesome. It's impressive, to me at least, that is.
So HDL doesn't build
No,
plaque?
not really.
Okay.
Once you have the plaque build up in those arteries, is that permanent at that point, or is there things that you can do that can get that plaque out of the arteries?
Well, usually once you see the cardiologist, they'll determine if you have enough of, that plaque there to maybe insert a stent to help open up that vessel. Taking an aspirin every day, it might help dissolve it a little bit, but it's not going to be that much helpful. It's hard to really break up that plaque. Usually you see that cardiologist, and that's when it's time for intervention so that they can, get rid of it by having that stent placed in.